Welcome everybody. I don't know if there's anybody on the phone. Welcome to Eric in Connecticut, and welcome to you folks here. This is the second of our innovation brown bags that Jean and I have been organizing. And it's great fun to have two friends and colleagues from JSI today. I've done my homework, I would have remembered the name of your center, but Anne Lafond, oh, that's it, the Center for Health Information Monitoring and Evaluation. And Anne Lafond, a long time ago, she tries to hide this from the public, but worked with Save UK.
I'm proud.
Yay!
8 years.
And then after that, she did the ritual animal sacrifice and joined GSI, and where she's been leading a lot of very exciting work in M&E research and so forth. And she comes with Soumya Alva, who's a demographer and a researcher, and used to work in a great company called ICF, where she had a terrible boss, abusive kind of a guy, hated the guy, so she went to work with Anne, and they've been doing great things together ever since. And so I don't know how you're going to slice the presentation, but I've known Anne, and well, I've known Anne for a long time. When I started my research on sustainability, she was one of the authors that I read and reviewed and everything. And then I met her, and it felt like she was no longer that famous. You know, when you meet people, you know, they become more human. So it's been great fun. Sometimes. And so we had great fun doing all kind of projects here and there in different directions, measuring evaluation, and obviously working together with Soumya. And I got to get a preview of what they're going to present today when Concern had a big wrap-up of their big innovation project that they had with Gates. And JSI kind of joined as a kind of M&E research monitoring and evaluation partner. And what we're going to hear about today is about using this, monitoring and evaluation approaches in an iterative manner to do some adaptive management. So before I say anything more foolish, I'm going to let people who know what they're talking about give it to us. So, Anne, Soumya,
thank you.
So try to stand around here.
All right. In the spotlight.
All right.
Okay. Good. Well, welcome. Hi, everyone. Thanks for having us here. We are really pleased to share some of our work and our thinking and our learning with this approach. Have all of you heard this phrase, adaptive management, being bandied about recently? Yes. Okay. And are you, like me, not really clear what it means? So we actually went into a trawl of the kind of words that kind of are associated with adaptive management. We've heard real-time data use, we've heard developmental evaluation, CLA, collaboration, learning and adaptation, MERL, doing development differently. So there's lots of ways that people are approaching this kind of idea of being more adaptive and using data more strategically to be adaptive. Okay, so what we're going to do is talk about what is adaptive management, why you would use it. We're going to talk about our experience using adaptive management and using an illustration of a project called CARE Community Hub, where we were the global research partner for a Concern worldwide program, and we were brought in to help them do kind of standard monitoring and evaluation, and through the process of wanting to be innovative, because it was called Innovation Strategy, they said, well, we need to do something different than me, and we approached it using developmental evaluation. So this slide says, what is adaptive management, if you can see it here already. And you can go ahead and walk through those things. First, it's evidence-driven program implementation strategy. I know Eric said, Eric said that it was really an M&E strategy, but we really like to think of it as a program strategy, and a program strategy that's embedded with data, right? So if you think of it as an M&E strategy, then like us poor M&E people, we're sitting in the closet, we're being asked questions, like did it work, and how did it work, and we never get to get engaged with people and do implementation. But really, adaptive management is about bringing measurement and implementation together, and that's really at the heart of it. The big question that you're asking is not so much did it work, but is it working, right? And why not? So you're thinking while you're implementing and thinking about what you can do with the data to help you implement better. So it's very much different than a simple PMP doing performance monitoring. Next. It's data to drive adaptation. So the idea is you're learning, and if something is working, well, you can keep going along that pathway. If it's not working, you take the opportunity of that learning, and you pivot, you change, you try and think about how can we be more effective. We're not waiting to the end, till the end line evaluation is in and saying, oh, gee, I wish we'd done. It takes a very iterative approach to implementation and evaluating while learning. So it brings all of that data and thinking together. And obviously the focus is better strategies, better, more effective, and tailored strategies. And it's become more and more frequent to see this kind of approach in global public health. We can do the next one, last global. And so I think it's being advocated all over the place. So next slide, please. Next slide. So here we have, a picture of the kind of evaluation throughout a project cycle, and we're used to doing this. We're used to doing needs assessment using data for project design, developing your M&E system, doing baseline, midterm evaluation. It's not that we don't use data, or we don't actually collect data, but adaptive management is really about focusing in on this part here and using that data in that period of time. So next slide. It builds a lot on Michael Quinn Patton's approach to evaluation, which he's really been advocating for many years, called developmental evaluation, collecting and analyzing real-time data in ways that lead to informed and ongoing decision-making. Next slide. USAID Learning Lab, we pulled this off one of their key people, because USAID has been talking a lot about how can we enable our grantees and our contractors to actually be more adaptive and to use information more effectively, knowing full well that our contracts often prevent us from doing that, but they are trying to advocate these kinds of approaches from the missions upwards to be more adaptive, to be more experimental in thinking while doing it. So here's the adaptive management cycle. It looks like a regular program planning cycle. But the key thing is that you've got this period, this adjustment. And this adjustment thing might happen more than once in the cycle of a project. It really is about planning, doing, thinking with data, and adjusting and learning, which is something that I think, if you've taught monitoring and evaluation, or if you've been trained in monitoring and evaluation, you're inherently supposed to be a data user. But we find in practice that we don't, A, get enough resources to really be good data users. B, people are implementing, and they've got their heads down and they're plowing away, and making them stop and think with data is really a pain for them. Like you're that irritating immunization program person that says, but the children aren't getting immunized. Why? And you're like, no, we just got to get that immunization out there. So it's really about trying to help people think with data and pause a bit. Next slide. Has a lot of roots in participatory action research, which has been used, for years, but often thinking about using it at community level and engaging communities and people that should be benefiting from your health programs, engaging them in the thinking process and in actually evaluating how things are going and feeding back. So it's this kind of cyclic approach to better outcomes. Next slide. Okay. This is sad. That's some really pretty slides. Okay. So the question was, why use adaptive management? So obviously, we're using it for data to create, collecting data to create information, but that has to be turned into knowledge and then acted upon. We want to use it in a way that is acted upon to improve performance. While this is inherent in what we do all the time, we don't always get the time and the energy and the methods in place to be able to do that part. Next slide. So how does this translate into what happens in the real world? You've all heard of quality improvement cycles. That's one really good example of organizations and teams that are using data in an iterative way to try and solve problems in the cycle of implementation. Organizations have been starting to take on adaptive management when they want to become more learning organizations. Not just doing, but thinking, not just learning about what they're implementing, but also learning about how their organization can evolve and become more effective. There's been work in program learning and routine reflection around like data use teams, things like that. And we've had even more extreme and more unusual is more of an iterative program cycle that's actually built into the design of your implementation strategy. And you'll see from the work that we did in Ghana with this project that the whole idea was that we would start with a plan and that we would allow ourselves to iterate on that plan. It was built into the design of the project. Next slide. So, key advantages of adaptive management. Before you go ahead, I was going to say, what do you think? What are the advantages? Before you give it away. Yes.
Making use of the evidence to drive the program forward.
Exactly. Can you go further? I mean, how does that help?
Okay, so as we see the data and we see what's going on, we can use that information as evidence to make course corrections or adjustments to our strategy or approach or even our activities on the ground or at.
And why would you want to do that?
To achieve the overall objective and the goal of the project.
Do you know how the project is going to unfold before you start?
No, we don't, and that is the unknown which adaptive management will help us to understand.
So it helps you think through what's changing. Sometimes the whole ground changes underneath your feet, right, when you're doing implementation. Okay, we can pop one of them. So, moving away from traditional M&E. Anybody else? Scott?
I feel like the program people might be more involved in adaptive management than in regular program work, because often the program people are hired after the proposal is written, so they weren't involved in the initial planning piece. So they can have more of a say as a project is unfolding.
Okay, good. Any other ideas? Yes.
I don't know if I'm adding, but I think typically some of the things we expected, I mean, as you say, the environment changes, but some of the things that we expected to work may not work. And rather than continuing with things that are not working, it allows you to make those course corrections early enough so that you can then maybe enhance what's working and then not continue at least tweak the things that are not working.
And when you are working in the field, do you feel you have the right kind of data to be able to do those kinds of adaptations? And why not?
Because of the type of data that's collected. There's not either the timeliness of getting that data or the format, the type of data that's collected does not allow you to make those decisions.
Any other barriers to using data adaptively that you've experienced?
Well, the rush of implementation, quite often we operate on very tight timelines, right?
Yeah.
So there's no time to think.
I think there's the lag between collecting the data and analyzing it, and so that it can be used. It's meant to be real time, but generally the M&E systems are not able to present real time data.
I guess there's always sort of
Can everyone speak up so
sorry.
that the people around here can hear it?
Yeah, so to prove effectiveness of an intervention, right, you normally have to stick with it for a certain period of time. So I'm thinking changing midway may affect your ability to say this was effective or these specific components together were effective.
Yeah, and that's one of the big arguments against it. If you're used to, more of a standard impact evaluation approach, you're supposed to be holding things constant. And we all know everything's constant. Not really, but you are ideally supposed to do that. And this interjects, an ability to take your design and morph it based on what you've learned. So, the debate is really, do you test something and prove its value, or do you test something and iterate it and get it better and better and better, and then pretend to go and prove its value, right? So it depends on, what stage you are in terms of testing an intervention and seeing if it works. Other people argue that it's more ethical to work this way. So why should you keep plowing away at something when you might be missing opportunities to help? Okay, well, let's just walk through these. I'm going to get moving so you can see an example. So it's obviously this idea of testing implementation strategies. So, often we're asked to design a project, get funding for it, and go and work on it and say, okay, this is going to work no matter what. And adaptive management says, we've made our best guess here. Our hypothesis is that if we implement in this way, with these people, in this setting, we're going to achieve these outcomes. But in fact, it's really an experiment. And it really acknowledges the fact that you need data to understand whether your experiment is working over a period of time. And it forces people to think a little bit more in a testing phase as opposed to just implementing two objectives to the end. People say it helps you develop a better program. That's the ideal, right? I know arguments against it are, well, if you keep trying this and you keep trying that and you never stick to anything, then how do you know what the program is? But the actual process of doing adaptive management, of iterating, becomes in and of itself part of your program strategy, right? So it's not just that you're putting adaptive management on top of everything as an M&E plan, but you're using adaptation as one of your strategies to get to better outcomes. Next one. So better tailoring of interventions to your context and to your target population. And as you said, it's supposed to be real time. It's rare that we actually really get real-time data. Maybe with the digital technology, we're getting more data quickly. But the idea is to cycle that data back into the program as quickly as you can in a way that's very usable to people that are sitting there and implementing. Okay, so last slide. Relevant and timely data are needed to make program implementation evidence-based. That's the goal. So the last slide is kind of comparing the kind of three strategies that we could use. We have traditional monitoring and evaluation, which we've all done for a lot. We have a PMP, a monitoring plan. We would do a standard baseline, midline, and endline. And most of it has been geared up to manage your program and to report to your funder. There's been a gradual push to think more and test more and introduce things like implementation research, where learning has become more popular, more coveted, more appreciated. Adaptive management takes it even further. You might have that learning question embedded in your work, but you're using process documentation and developmental evaluation for the purpose of intentionally being able to adapt, to use that data to make sure that your program is going in the direction you want, and if your theory of change isn't playing out, that you have that opportunity that's evidence-based, not just instinct-based, to make decisions about pivoting or course corrections. So keep that in mind. I would think that different programs use different kinds of strategies. I would think adaptive management is there in situations where you're still trying to learn about what works with this population in this setting. If you don't have a really good, strong model that you've used before, and it can be applied to a lot of different programs. So Soumya is going to talk about how we worked with Concern in a project that was working on health worker motivation. Can you have the next slide, please? And this is what it's like.
So what I'm going to be talking about is about JSI's experience with adaptive management, how we used it, and specifically go in depth into one of the projects called Care Community Hub, which involved building this app called CHN on the Go. I did bring a few copies of some of the documentation we did of project findings, but we can get to that later. So it's really more methodological. I'm not going to focus on the results of what we found, but really talking about this approach and how we used it and how it, you could use it in other places.
Yeah.
So this is a little bit of an overview of JSI's approach that we used for this body of projects that fell under the Innovations for Maternal Newborn Child Health Initiative. And I can get to that a little bit later. So all of these projects involved a strategy where they were all designed using a human-centered design approach. It wasn't a consistent human-centered design. They used it in, I want to say, there were various flavors. In a couple of the projects, it was really intense. In a couple of the projects, it was, let's do a small workshop and figure it out. So they were all in different ways, but they still had this, user-centered design approach in building the project. And once the project was designed, we were engaged in this process of trying to understand whether the project was effective, but we also wanted to not just do a baseline and an end line, we wanted to go and collect data along the way as well to try and understand how implementation was going on. and ask different questions at different stages to see what was working well, what was not, what should change, all of those questions. So there was, and that went and fed back using this adaptive management approach. It went and fed back into the program, and we follow this iterative learning and adaptation approach. Yeah. Next one, please. So very quickly, some of these points are things that will keep coming up during our presentation. Anne mentioned some of them earlier. I'm bringing them up, and specifically in the case of the project, you may see these again. But basically, it's just to show that we did follow a very rigorous monitoring, research monitoring and evaluation approach. You had your standard indicators. We had qualitative interviews. We had all kinds of data. We had multiple waves of data collection, different types of data collection methods that we had to piece together and try and put your story together. At the same time, we were always engaging with stakeholders and the program implementers. So we always, fed these back to the program implementation teams, where we would sit together and try and see, does this make sense? How should we change it? And so on. But we also shared this information with the government as well, which was actively engaged in this project. So they knew where things were going on. And we made program improvements along the way. So what we found effective also was visualizing results. So that's why I brought an example of the slide doc that we put together. This is a document that we put together at the very end. However, along the way as well, we had multiple versions of these things based on data that was available. So it was a very easy to use, it wasn't a dense report. It was an easy to use format that we could use to share with people we were working with. Yes. So what does it take to make something like this work? So what was most important was, at least in the initial stages, you need a very supportive funder and an implementing partner. So if they don't believe in this approach, I don't think it could get started. You can put this on. So if they don't believe that this is a worthwhile approach, I don't think you could go ahead with this approach at all. We need multiple stakeholders who are also willing and interested in engaging with us, using this data and trying to work through it with us. If there's no interest at the end, really, it's like pointless. Why are we doing this? We're just doing it for ourselves. So I think we need input from interest from both sides, from where the money is coming as well as the scenario where you're implementing it and the government or whoever else is there who is actively involved. We need a good group of people who talk to each other, the research and the evaluators, and along with the program implementation team, that they're willing to engage together to try and see how to make this program work better. And to do this, we use multiple pieces of information that we work through and collect and try and put it together. So all of these are critical pieces that are important to make this work. Yeah. Next, please. So what I'm going to do is show an example of a specific project. We had several projects that we use this approach with. The specific project is, I don't know if you've heard about it. There have been some presentations of this as well. It's called CHN on the Go, an app that was developed in Ghana by Grameen Foundation with funding from Gates Foundation through Concern Worldwide, but ultimately Grameen Foundation in Ghana. And so I'm going to walk through this to show you how we used it. Okay, so all this fell under the umbrella of the Innovations for Maternal Newborn Child Health Initiative. So this was an initiative that was implemented over several years, over 2 phases. So we were really involved in the second phase of this project. It was a project it was an initiative that was implemented by Concern Worldwide in both phases. JSR was a global research partner in the second phase, and we did research on each one of the 4 phase 2 pilots that were implemented. They were in 3 countries, in Ghana, Kenya, and Sierra Leone. These were very different pilots, and I'm not going to go into those in depth, but basically to say they were very different. They were approximately 2-year interventions. They were designed using a human-centered design approach, and we worked with local research partners in each country, and Concern Worldwide also had local implementing partners in each country. So it's really a big mix of people. And although these projects were very different, we tried to follow a very similar approach across all of them. So some had more of a qualitative focus, some had a more in-depth quantitative focus, depending on the nature. But really, triangulating information, building a theory of change, putting together information, multiple time points, putting together data in easy visual formats, sharing with stakeholders. There was a very consistent approach that we wanted to follow across all of these. Next, please. So more about the CHN on the Go app. But basically, it's an app. It had multiple components, which I will get into. But the main premise behind it was, the assumption was that you have workers, these are community health nurses in Ghana, and they are located in districts that are not their districts. They're located in situations where they're not as comfortable. Sometimes they don't even speak the language. They don't necessarily know people. It's not the most easy location, and they face many barriers. And the idea was that if we could address the barriers of job satisfaction and motivation, it would potentially lead to improvements in quality of care and improved health outcomes. So our focus was really addressing the issue of job satisfaction and motivation. We didn't go all the way to the end of looking at improvements in maternal health outcomes or child health outcomes, but that's where the trajectory was going. So this app was designed through a very in-depth human-centered design approach. It was implemented by Grameen Foundation in Ghana, and the human-centered design approach was done engaging an organization called Think Place from Australia that has been working across various development projects. And so they came in with the team. I was not involved with the project at that time, but they came in with the team and had a very focused, in-depth 2-week workshop trying to understand everything that was going on at all levels, right from the national level all the way to the lowest level with the CHNs, to try and see what their needs were. And I'm not going to go into this depth because a couple months from now, Anne is going to be talking about human-centered design, and that's when we can talk about all the things that went into building an app of this kind and what human-centered design is all about. So it was designed using that approach, and the multiple components of that app, which were built to eliminate barriers in job satisfaction and motivation, covered some of the topics that are linked here. So they felt that these nurses were isolated, they need to be connected, they needed more professional development to keep their learning, and they needed other ways to engage them. And so that's how the app was developed. Go on. So again, in 5 districts, we had about 50 health centers and CHIPs, and a total of about 300 CHNs and their supervisors. The reason we're talking about supervisors is, although we're talking about community health nurses, they don't work in isolation. You really can't address their needs without talking about the system that they live in and they work in and the supervisors they engage with. So that's why supervisors came into the picture. And it was about a 2-year project. Go ahead. So this was what the app was about. One component was it had a clinical refresher where it was like a decision tree where you opened your phone, you said, you're pregnant, this is the stage you're at, these are the problems you're facing. You sort of go through that tree the decision tree to kind of guide you on what next steps you need to follow. So the app provided that guidance using the point of care. There was the Learning Center, which actually through K4 Health, they had a whole bunch of courses on family planning and different aspects of maternal, newborn, and child health, where they could take these courses and they could get credit. And they tried to link it to their professional development, where they had to renew their license every year. And if they took so many courses, that would meet those requirements. So that was the Learning Center. You had a planner, which would help you plan your activities. They had a calendar, they would put their visits in, and the idea was that you'd become more efficient and by being able to plan your activities, and there would be a record of where you went and what you did. Another part that was very successful was WhatsApp. We wanted to build a communication component because we wanted all of the nurses to be connected. And initially, I think what they wanted to do was build another app like Google Hangout. But then they said, there's WhatsApp anyway, how about we use that? And we found that was very successful, not just linking nurses themselves, but between nurses and the supervisors. It was, and sometimes for professional reasons, sometimes for not professional reasons, but they all met the same objective of helping nurses. There was another module called Staying Well, which provided motivational messages to people. And finally, Achievement Center pulled information from the Learning Center, the courses they took, and the work planning section, the planner, and had a record of what they achieved, and then the supervisors would be able to see that. So the app actually was multifaceted. And the reason was that if you're talking about motivation, you can't just pull out one component, you need to address a lot of these things together. Yeah. So the question we were trying to ask with this was, what was the effect of this app on improving motivation and satisfaction levels among community health nurses? You can flip these. So what was our role in this whole process? So we were the global research partner, and as part of this project, we decided to follow this adaptive management approach. We didn't want to come in the beginning, do a baseline, go at the end, do an end line, and collect monitoring indicators along the way. We felt we needed to do more. So we started the whole thing with trying to understand what the project was about and build a theory of change, to understand all the pathways and the processes through which things would work to make this program a success. So we followed a rigorous evaluation approach and decided to use multiple data collection points and multiple methods as well to collect data. And these are, again, things that we talked about. We wanted to use real-time data from different time points and engage with stakeholders and implementers and try and see how to make this a better program. In some ways, it actually helped with this particular project that it was software-based. And at some point, with a lot of software, they do follow this very iterative approach, even in building the software. So although we use this approach in all of the other projects, it seems like in this particular case, it seemed more natural. The implementers were already used to that in terms of just building the app and the software. But here we had to take a more comprehensive approach, also talking about how this app fit with the nurses and with the system as a whole, the whole health system at the national and the district levels. Yeah. So what we have here is an adaptation of our theory of change. It's a little complicated, so we tried to compress our bigger theory of change into a simpler picture. So basically what we were trying to achieve was understand whether there were improvements in motivation. But it's really hard. What is motivation? So motivation is not an easy concept, and we found that for something like motivation, you had to break it down into multiple components. And interestingly, these were some of the topics that also came up at the human-centered design workshops in the beginning to try and design the product itself. So these were all components then, and we felt that even to understand whether it was working, we needed to break it down into these components. So we're talking about emotional support, professional development, respect, confidence, time management, and recognition. And improvements in all of these aspects contributed to different aspects of motivation that nurses would feel. And how it got implemented was through the various components of the app itself. So the assumption was that health workers feel unmotivated and there's need to make a change, and this was the way of doing it. Go ahead. It's okay, I'm not going to take that long. Yeah. Oops, I think we want to go back. Right. So what I want to show here was, that's about the app itself and the nurse and the motivation they face. However, they don't work in isolation. They're working with supervisors, they're working with the health system, and so on. So what they decided to do was build a supervisor app for improved monitoring and supervision. So nurses could communicate through WhatsApp between themselves and with their supervisors, and supervisors knew what they were trying to do, where they were doing as well, where things were, and gather information. So that sort of took the motivation from the individual and took into account other people that they worked with as well. And as I mentioned earlier, the objective, although we looked at motivation, was improved performance, quality of care, improved health outcomes, although we didn't actually measure that aspect. Yeah. So questions we were trying to understand were, of course, this is very standard, What's the baseline level? What's the end line level? How is it different across areas? Did it change? The second thing we were trying to understand was, what's the association? Did this app make a difference? Did this app matter at all? And thirdly, we were trying to figure out, was this project implemented as planned? Were there barriers? This is really more of an implementation research type of thing. Trying to see what were all the challenges, what worked well, how could you do things differently. But the focus, we took this a little further to try and go back to a theory of change and say, if we expect each component of that app to work in a certain way, is it really working the way it was supposed to work? And that's where the theory of change came in, and we questioned each one of those. So this is a figure we saw earlier. You may want to just slowly flip. So what we did was we had baseline and end-line data collection at the end of the planning process and at the end. And although it was designed with a human-centered design approach, we went along with the project with multiple data collection points. We called it process documentation. That we wanted to understand how things were going on at that point in time, through that point in time, and document that process using various pieces of data and piece it all together, and then use it to sit together and refine the program. So the project started in the summer of 2014, ended April 2016. We had a baseline and an end line. And in between, we call them PD. We have these rounds of in-depth qualitative process documentation. So we went and we said at this point in time, in the first case, in May, between May and August 2014, we said, what do we really want to find out? What's going on? What are the burning questions right now? And we went and interviewed nurses, we interviewed supervisors, we interviewed district directors, and some at the national level as well as program implementers, to try and figure out what was happening. By the time the second round came around in 2015, the questions were different. The app had also gone through a very iterative process. They had not thought about the supervision, module earlier, but supervision started becoming very important, and it thought it was important. So we started questioning the supervision app, how well it was working, what the challenges were, how people were satisfied. So it wasn't a standard set of tools that we implemented at multiple time points. Depending on the need, we had to change the tools as well and ask different questions. And sometimes we included different people. So we had to go and talk to, in the Ghana Health Service, people in the human resource department as well, because hiring processes, promotion processes are all related. We also went and talked to other stakeholders in the nursing and midwifery council, because they're the ones who provide accreditation for courses. So really, these questions and the different people involved kept changing at the different time points. It wasn't a standard set. These MACPI surveys were quick e-surveys that Grameen Foundation was very interested in going through with, and we supported them with, was really pushing a survey with about 30 questions to the nurses, so that they could answer questions on how they felt about the app, what technical problems they were facing, how they would want to change things, and so on. So those took place at two different time points. We also felt we wanted some other quick feedback from nurses. The PD was very in-depth qualitative data collection, but sometimes we just wanted to ask them a question. So which module do you like best? Why don't you like it? How would you like things differently? Basically 4 or 5 questions. Are you satisfied with this whole thing? 4 or 5 questions that we asked nurses as well. The feedback sessions were organized by Grameen because they were building an app. They needed to know how people like the app itself from a technical standpoint. What module was working well, what you need to change. So they, in their own way, conducted their own feedback sessions with groups of nurses. So this is just a picture of, there were so many different types of data collection, and it wasn't a consistent set. So it's not like we had one tool and we just implemented it 4 times. They kept changing. And we had to, depending on what the need was, and ask questions differently and to different people. And what we did also was share information at the end of the first round of PD and the second round of PD back to the community. So we made presentations in the country as well as sitting around with the implementation teams to figure out where things were. Okay, of course, I didn't even get to the monitoring indicators. There are standard monitoring indicators as well. We could see, because this was an app, you would think it would be easier that you get data automatically from the app itself to see how usage was, but believe me, it had its own set of challenges. It's almost easier to go collect the data yourself. Getting data automatically from a system like this is worth another presentation. But it just goes to show, how many things that we were looking at. Yeah. So again, questions we were asking was, where we had the theory of change, are those pathways being followed the way we had expected? Are things going as we had planned? What are challenges they're facing? Why do people like certain modules? Why don't they like other modules? What's the overall effect? Is it improving their satisfaction? So it's big questions of, did it change your life? But at the same time, it's a lot of implementation related questions as well, and digging into the different aspects of motivation. Again, just a quick summary of things that we've said before. What was our approach? We had a very, we worked closely with local research partners, we worked closely with the implementation teams, both globally, concerned worldwide, as well as in the country. We collected different types of data, we shared information with stakeholders, we tried to find easy ways of presenting data, and tried our best to piece all the information together to tell our story. Yeah. Here are some specific examples of how we think that an adaptive management approach helped us, rather than just getting data in the beginning at the end. I mean, this was a project where the app was, I think the first round of the app when it went out had only 2 or 3 modules, and it was really basic. And then they slowly added more modules in. And it was important for them to get information, on a regular basis on how things were working. And using these different data collection methods helped us and them with designing the app in a better way. The technical issues they were facing, all of those challenges. And this particular aspect on supervision, it's like, it's something that really came out, after a year. There was really no emphasis on supervision. It was really like, it's about the nurse and her app. But then they tried to, engage supervisors more, and they built a whole supervision app as well, which supervisors would have and use and access this information. Of course, there were a lot of network challenges. The data had to be synced, it had to flow, and everything in the nurse's phone needed to, their devices needed to be on it with good network coverage to be able to get the information on the supervision app as well. But that apart, I think there was a big effort to try and link the two groups together because they work closely together, and it was important. That was something that really came out halfway through the project itself. And this last part, I think it builds stakeholder interest. It's not like we had to work through 2 years of the project and at the end give them our grand end-line findings, and then they would look at it and say, okay, this is a good project, let's do it in this other district. I think there was stakeholder engagement along the way continuously, not just through us, but also through the implementing teams themselves. So even before the end of the project, they all knew, they didn't need the findings, they all knew they liked this. The nurses liked it, the district directors liked it, the regional directors liked it, and there was that buy-in that people felt, they all felt that they were very interested. They didn't need to wait till 2 years after to learn that this was something that they wanted to continue on. Yes. Very, very quickly, what are some benefits? Again, it's real-time data that we're getting. People realize the value of iteration. I'm going to mix this up a little bit. While everybody realized the value of iteration, it was also challenging. In the beginning, it's really very hard with program implementers. They don't want this. They're not very interested. And it was only over time, I think they realized the value of this while we pushed for it and said, we have to do this, that they started valuing and started using the data more and more. In the beginning, it was really a case of JSI trying to say, okay, this is what we need to be doing. I don't think the program implementers totally bought into it. We had a supportive funder who was like, okay, go ahead and do what you want. But that part, it took them a little while to understand the value of what we were doing. But it's a very time-intensive, resource-intensive process. It's also the kind of thing where I think instead of just a simple 1-2 data point data collection, you need to get your head into the whole project. You need to understand how all the, everybody fits into the whole thing. You need to understand the whole system. And the program implementers too, if they're really engaged, they played a big role in helping us develop our tools as well. Because they knew what was going on in the ground, and they knew what problems were being faced, and they would say, let's take a little bit more on this topic. So I think that input that we got from the program implementation teams is really very useful, but it's a question of everybody being engaged and wanting to do this to make it really successful. We're almost at the end. I'm not going to go into this because it's really not about findings, but I felt I had to tell you a little bit about what happened to this project. The app had multiple modules, and of course, some modules were more successful than others, just based on usage and what people felt about it. they really liked the aspect of a job aid. That was the most successful part module of the app. The nurses really liked the work planning aspect, the knowledge they were getting. They really loved the WhatsApp component. Supervisors liked the WhatsApp component of being able to communicate and help them with their monitoring and supervision processes. Nurses also felt that they had this increased knowledge using this phone. Even with clients they were dealing with, they had this extra confidence that they knew a little bit more. They didn't feel out of touch. So the different modules of the app, worked in different ways, and they liked it. The CHNs, they all wanted to continue using the app, and there was a lot of support from the government as well to continue on. I mean, at this point, the project has ended, but I believe, maybe you know more about this. They're still continuing to use it, but I don't think there's any active support going on right from the project. But there was a lot of interest in potential in, nurses were willing to, use their own phones to put this app in other districts as well. So they were trying it out in a couple of neighboring districts. It's a little covered out there, but if you have access to the slide set, you should be able to see. We do have more information on the findings and the project itself at the web link that we have there, including end-line findings as well as other findings along the way that we came along. And finally, going back to some of the points that Anne mentioned earlier, I just wanted to put together a listing of some of these resources on adaptive management. You have the Better Evaluation website, which has been having a few blogs recently on adaptive management. There's been a lot of talk with the USAID Learning Lab. They've been talking for a while now about their CLA approach they're trying to implement in countries. Another new innovative approach, I don't know, you may have come across this, called Merlin, that came out of the Global Development Lab, where USAID was trying to experiment with different ways of doing monitoring, evaluation, and research. And there's also the doing differently, developing differently website as well. There's a lot of interest with donors. USAID has showing a lot of interest. There's also interest from DFID in this approach, and it's being used more and more. Sometimes the challenge is people want an evaluation with a beginning and an end. This doesn't really have a beginning and an end. And I think the whole purpose of the whole approach is really to come up with a better product, with a better implementation. You can't really say, this is what we started off with, this is what we ended with, and it worked or it didn't work. It's got different questions that you're trying to answer with an approach of this kind. Thank you.
So we've got a limited amount of time for questions for those of you who have something else after that, so we're going to jump into it. But we do have the room, and Anne and Soumya have a little bit of time, so people who can spill over the hours of 3 o'clock mark, we can have an ongoing discussion. So, I don't know, we don't have really a setup for a panel, or we can, you can stand, you can turn around. So are there any questions on the phone or in Connecticut? Let's start with the remote people. Are there any questions for Anne or Soumya? So we'll...
I assume we can hear them.
No, not from Fairfield.
Okay. How about you guys, any questions? Come on, you have something?
I have a question. I wanted to see if you can talk more about the review meetings that happen. So how often do the review meetings happen? Who was involved? So was it program staff, ME staff, and also participants or beneficiaries? And then what was discussed during the meeting? So are you reviewing the 2OC? Are you just evaluating activities and then refining it for the next set of activities that'll happen in a month or quarter? What exactly happened?
So it was all done slightly differently because each one of these projects was led by, I just gave you one example, but each one of these was led by a different team leader, but we followed a generic approach in general. So what we did was we looked through the findings of our qualitative data collection when we had these meetings. It was an internal meeting over a day or two, and it was JSI, it was the implementation partner, our local research partner who helped us with data collection and put things together. We had the implementation team in the country. In our case, in this particular case, it was Grameen Foundation. And we also had Concern Worldwide, which was the implementing partner, that we all sat together and tried to piece together, this is what our monitoring data is showing. Because every time we look at data, each group looks at it differently. I mean, we don't all, this is one opportunity for everyone to come together and discuss. Because otherwise we would just look at it by ourselves. But here was an opportunity to include the program implementation team and try and say if something was not working well or things were low, it's like, why do you think? Were there any specific challenges? So that interaction was possible for us to show why different components of the app were working well or not working well. Also sharing information, like you'd ask nurses, what did you like about it? What were aspects that were not being addressed? What would you like to see? How would it, do you really think this made a difference in your life? And so that was feedback that was useful for us to share internally and at this point really be honest with each other on this part is just not working well at all. And you need to accept it and maybe think of a way of, maybe we don't want to focus on it so much. People are talking about supervision, that's important, let's try and focus on that. So it was a way of sharing and being honest with each other and trying to understand what was really going on with this project. We were not answerable to anyone outside. But that said, we also did present to larger stakeholders. We had a more formal meeting with the government itself where we presented our findings at the national level and at the regional level. And the district directors were also involved in that. That was a more formal engagement that we did. But using this information, the implementation teams were always in touch with stakeholders. And this was extra information that they could use on how the program was working as they engaged with them continuously. So it was at different levels. In this particular project, for whatever reason, I don't know, we didn't actually go and actively go to the community health nurses, specifically as a community and say, this is what we found. We really engaged with the district level. But thinking back now, I feel like that's something we should have done as well, that we should have gone back and shared with them. And I know with some of our other projects, the other one in Sierra Leone, they actually went back to the traditional birth attendants and shared this with them, with this information. So this has been a learning experience for us as well. I think going forward, there are some things I would do a little bit differently or change in some ways, because I think it is important to go back to community members and the nurses themselves who use these and try and feed back to them. This is what generally people think about it, to show them what we found.
I just want to add, the program teams in the beginning said, why are you coming back so often? Like, why are you bringing this data back? And we kept saying, well, it's for you to reflect, right? And it was very hard to get everybody to take a breath and say, okay, let's reflect, right? And by the end, there was a lot of good feedback saying this really helped us. We never knew how much it could help us. We were struggling with the idea of how much is enough data and how much is too much data. We're still at that point. Maybe we overdid it in some places and we didn't do enough in other places, and finding that sweet spot that's, getting to the essence of really useful data, I think is still a challenge.
And the challenge with this also is you have so many pieces of data and sometimes they contradict each other. And then trying to piece that story together is really very hard. I mean, you talk to a nurse sometimes and they say, oh, they love it. And then you look at the usage data, it's like, they're not using it at all. And like, how do you tell the story together? And that becomes a little challenging sometimes.
Did you find any, a couple different questions in terms of quality. First of all, in terms of the quality of the data that you were receiving, did you find any kind of a difference in the quality of the data by doing this iterative approach? You going back and you're checking on it, well, this stuff doesn't make any sense. And so they see that it's actually being used for something and maybe start generating better quality data.
I think
adding better, things
yeah.
like that.
No, it's a good point, because sometimes, we look at data, like the usage data that was coming out from the phones. This is why I said, you think you have a system all in place and you could get data automatically and it's in this beautiful Excel sheet, and instead of going and conducting a survey and collecting, we had tons of monitoring data. But we would look at it and sometimes it would make no sense. So this was an opportunity to sit with the program implementation team. It's like, you say everybody's using it all the time, but look at what it's showing. It's like, this is what, and it doesn't make sense. And it helped. I think we engaged with them a little bit more. We had to involve their development teams as well to see they were extracting the data the right way, to be able to answer our questions, was it even right? And in that way, in this particular example, I definitely think the quality of the data improved, because they were not even pulling out the right pieces of information for us. It's a learning process for everybody. So absolutely, I think your tools get refined more. You feel like in the first round, I didn't ask all the right questions this way. I might want to ask this a little bit differently. You just find different ways of doing things, absolutely.
And it depends on how much experience people have doing in-depth qualitative interviews. I mean, you find some teams were really well versed in it and they could do it themselves. Other teams needed a lot more coaching, a lot more oversight, and you know, the data always varied depending on our implementing, our research partners. So, you know, we had to make that decision early on, once we started working with them, how much we had to be with them to get the data collected. That's normal everywhere. The qual data is always a challenge. People don't have a lot of experience.
I had a second question related to quality. I know that your focus was on the job satisfaction and motivation of the community health nurses, but did you look at all about the quality of their work? Not the quality of the data, but the quality of their work.
No, we didn't
Because
really.
some of the pieces of this app might be affecting that as well.
Right, yeah, I think that needed a more, you know, you needed to do observations of their work to be able to assess that. We didn't actually do it, but potentially yes. I mean, I think if we were to push this further to, you know, look to see how it really improved health, did they actually do better work? Did the quality of care improve? I would definitely want to do that. Yes, absolutely.
And
It's a
concerns
process.
had come from
Yes.
a previous project where they were looking at the psychosocial kind of wellness of health workers. So they were really focused on that, how do we enable health workers to feel good about their work, to feel motivated. And you know, there was this push from government, well, does it affect quality of care? That's what we care about.
That's what they care about.
And the whole design of the intervention was just for motivation and job satisfaction. And we said, it's really not fair to then add this other outcome on when we didn't intentionally design the app for quality of care improvement. We designed it for motivation. But the question has arisen from the Gates Foundation, now let's see if it makes a difference for quality of care. So we might be able to go back and try and see.
Because, you know, it wasn't designed for that, and at times we'd go back to the implementation team and say, okay, I mean, you're planning your life better, you're conducting all these, doing all these immunizations, doing all this stuff. Do you think it really improved the life of children in this community? And they themselves would say, I don't know, and I can't say that. I can't say we did more immunizations just because you could plan your life or have, you know, all of these things. They were not very comfortable with that stretch as well. We had never thought of it initially to design it that way, but that's what the government really wants sometimes.
But I think we need to accept that once we have a coherence theory for how things happen, sometimes we've got to focus on a part of it. We can't always be looking at the whole of it. I mean, we've got the, you know, powers that be of, say, the children in the next room, you know, and I'm sure they're not looking at the whole thing. They're not checking the education level of every last child, and they've got to look at some partial results of the health team and the education team, and we, you know, if you're not designed to look at impact, it's pretty I mean, the theory about workers' performance, motivation, and wanting to show up to work, I mean, you don't have to re-demonstrate that every time. I mean, we know that people that are not motivated don't work very well. I think we're hitting a time mark. All right.
It's okay, thanks.
Thank you. I just wanted to ask, I'm no expert in NME, but just listening to your presentation, it struck me that there may be some overlap or similarities with other kinds of evaluation, like I'm thinking of realist evaluation, and even maybe just a traditional pilot. So what would you say is the thing that sets adaptive management apart, or is it more like it's a spectrum and certain things fall along the spectrum?
That's a good question.
Challenge question.
Yeah, no, it's good. I mean, I think, you know, even pilots are, you know, trying to test something in a small frame or a small setting, right? So they still have that, we want to get from A to B, and they plow ahead to do that. And I think here, you want to get to B, but how you get there is open, right? You have a theory, and then as you implement it, you learn more about it. And you're allowed, maybe you don't have to, but you're allowed to rethink that theory and try and adapt it. And I think it is that embedding that opportunity to pivot, to move your strategy, which is quite different. Because the pilot is supposed to be then, you know, a precursor to letting you go to a bigger scale.
So there's no defined end period, it's just sort of we're implementing and we can change at any point based on the data that we're collecting.
Yeah, and I think what's interesting about that is that, what human-centered design people will say is life is about iteration. You're always learning and adapting and learning and adapting, and that's how you survive. This is kind of Darwin, right? So, at what point do you stop and say, this is good enough to get to the most people, uptake is going to be very strong, and it's time to scale. So I think you're getting to a point where you feel you've got a program theory that is more universally accepted. You're always going to have some people that are outliers that you aren't going to be able to reach, and you may need a different strategy to get there. But you're trying to find something that can potentially go to scale. But I think, it's still always a value judgment, right? You're still taking the data, thinking about what you know about that setting, what you've learned about it, what you think is working. And I think with the human-centered design approach, you were constantly going back to the end user, whether it was a health worker or a traditional birth attendant or the mothers, and saying, is this working for you, right? Or saying, well, is knowledge improving? And if, knowledge wasn't really improving, part of it, the uptake was good, but maybe the delivery of the messaging wasn't so great.
But it was really interesting. A couple of weeks ago, I went to a meeting at 3IE, and they were, organizing this thing about, they had this evaluation week or evidence week or something that they organized. And so they had this all-day meeting, and you think 3IE is all about just impact evaluation, these really quantitative approaches. But you heard of things like this, about adaptive management and the need to not just wait till the end line to get your story, to try and get information on what's going on even before. And be able to feed that into the program and not wait. And maybe for something large projects, you may want to follow an adaptive management approach in the beginning to try and this iterative thing, refine your program, see that it's working well, and then scale it up and then really measure to what extent it's really affecting. So maybe it needs to be a two-phased approach that you want to use. And I thought they were way more creative and open when people were talking about these things rather than a standard evaluation approach.
Well, I definitely see this in the work that I'm doing right now. I didn't know anything, so.
Yeah. No, I was very curious. I mean, one of the things I wanted to ask is do you see yourself using? I mean, have you used parts of these things? I think as implementers, we do it in our own way. You don't call it anything consistent. You don't have a consistent approach, but yes, you do it in your own way. Your program is not perfect right from the beginning.
Right.
And
you do as much as you can
absolutely.
with the time and the resources.
Available.
I think you do it because you have to survive, otherwise you don't fit your environment that changes and you perish. That's Darwin. Yeah. I think what's changing is that we're trying to think of our development programs as if Darwin were real. Because by and large, our program designs, as they come from heaven to us or from the donors, are basically very positivist in nature. And so I think we're starting to come to realization that a project where you're going to spend 10, 20, $50 million, the environment in which you work in year one is not the same as the environment in which you work in year 2, 3, 4, 5, because you've been pouring, there's been a lot of changes in the environment that you have nothing to do, plus you've been in this place and spending a lot of money and hiring people, you've changed the context. So, and as much as the long-term goals, the big picture goals, for an else, of program impact, those, they're not going to change much. But the intermediary objectives, a lot of these we don't really know, so we need to be able to navigate that.
Those pathways that you're guessing.
Exactly. You're guessing, And
I think what's also interesting is it allows people to say, I think we can do it differently, as opposed to just standing up and saying, everything's fine, we're going to keep implementing. You can actually say, actually, this isn't going well, and if the funder is into it, they're like, well, then fix it, right? Don't just keep telling us everything's fine and plow ahead as usual. If you really need to change, then it's okay, because we're so used to being, held accountable for the thing we wrote, in 2017, and we're still implementing it in 2025, and it may not even be valid anymore, right? So I think it's more, to me, it's more realistic as a way of working.
And I feel like in a lot of ways we have been doing this, but it wasn't given an umbrella name. Because we had process indicators all along the way. And in SAVE, we push a lot in terms of data, we call it data for decision making. So that we have to feedback regularly on what we're doing, and from a community level, from a district level, provincial level, whatever it might be. It's just this overall concept, adaptive management gives the idea that management is going to be changing. That the way that you manage the overall project is going to be changing. Which I think is kind of cool. My question for y'all is more of a practical thing. Who was doing all of this? Was it people in Washington that were taking this data, analyzing it, and then going back and feeding it back into the communities, the country?
We were
or was it
driving most of it. you
from
know.
here? Yeah.
Yes, we were driving most of it. I think some of it is also, it depends on in the country, I mean the confidence you have in your local research partners.
Mhm.
So if you just want to share the data collection with them, or really you want to engage them more in thinking through because they know the context better,
Mhm.
it's really a question of who you have that you're working with. So we were driving most of it, but I know that in the case of our Sierra Leone project, the program implementation team, they worked with us to compile some of this information and go into the communities and share that information. So every quarter, they would actually have these meetings with the traditional birth attendants to share the findings based on what we had found, the monitoring data and the qualitative data, and they would go ahead and do that. And there, the program, I think it was, they took the initiative to do that in a consistent manner. In lots of ways, I think the implementation teams, worked with, they continuously engaged with stakeholders, and they did use that information, but not in a consistent way. But that was one example where I think they definitely used it.
I think it would be really good to have someone either from our team embedded in the program implementation team. It would allow a lot more of that continued dialogue and reflection to go on, or to have a local partner that was doing that. I think possibly because there was a little bit of skepticism on the implementers about this, that we needed to kind of keep demonstrating the value of it. Going forward, you still have to have that person in the field very well coached or very aware and have that voice. I mean, the more you know about the implementation, the better you are at helping people use data to make decisions, right? So we spend a lot of time trying to extract program understanding out of people, saying, okay, you've made a decision to do this, when were you going to tell us that? We need to know that, right? So, people spend a lot of time in the field working.
But at the same time, because you were a partner, you were not from the house, it came with its complexities, but at the same time, you were able to put the push to make this happen.
Yeah.
If you'd been the M&E shop of concern, would you have been able to do it? Or would you even have kept the incentive to do it?
Right.
Here you had a clear role. That was your role. If you had been in the team, maybe at some point you would have been captured by, oh, we need to implement. Why do we stop and sit down and talk again and collect more data?
We're too busy.
Yeah.
You're too busy.
We're all
No?
too busy all the time.
And sometimes with implementation, it's like they keep that distance.
If the women's work never ends, why start?
Women's work never ends what?
Why start?
I think sometimes we were like an irritating, group of people.
I can imagine that. I can.
They were
Can I
like,
be there?
oh,
I'm good at that.
Yeah, you're asking questions again.
Yeah.
But we were involved in all their monthly progress meetings and all of that stuff, and on a continuous basis. We just didn't step in and out. I think they tried to. We pushed them, but they tried to include us in those things. But you just never know. Once we got off the phone, maybe they had their own little meeting too, whatever they wanted to do without us.
We also
never
made
know.
them have theories of change, right?
Yeah.
I mean, they were like, okay, and their theories of change were like A, B. We were like, no. We need to know why this theory is going to work, right? And we not only is it not possible to do an impact evaluation without a good pathway, but we want you to put your theories out there so that you can test them. And that was new. There was this kind of instinctive ability to implement that was coming through, and we kept saying, well, if you really think you know what's going to happen, write it down, and then let's test it. That was also irritating to people, right? But it made it easier for us than to measure.
Yep.
Right? So it's that kind of tension that you find often.
But they started using our theories of change
They did.
later. They never had one when they designed their project. But later on, they were using our theory. That became the project theory of change. It wasn't just for us.